Today, we're going to take a look at the body's cardiovascular status during times of exercise and anemia. Let's take exercise first. So you're either running from a bear or walking up a single flight of stairs in Brody. It's practically the same thing. The goal of the system during exercise is to increase the cardiac output and divert the blood where it's needed, the heart and the muscles. Let's take a look at the pressure and flow equation. Pressure is equal to the flow times the resistance. If we arrange this equation, in order to increase the flow, then we can increase the driving pressures or we can drop the resistance. So when we're exercising, the rate of ATP and O2 consumption will exceed the supply. As we convert to anaerobic metabolism, we produce lactate and other vasodilators. This drops the resistance. When we drop the resistance, this increases the flow. This is what we call active hyperemia. But we remember that when we drop the resistance, our body could sense this as a drop in the arterial pressure. This will activate our baroreceptors and kick us into a sympathetic drive. Activating the sympathetic nervous system will constrict the veins. This increases the preload and increases the cardiac output via the Frank-Starling mechanism. The sympathetic nervous system also increases the heart rate and the contractility, just as we've discussed before. These factors combine to increase the systolic blood pressure and increase the heart rate, will offset the change in the diastolic blood pressure that came as a result from the drop in resistance. In addition to the increase in output and flow to the tissues, there's an increase in oxygen extraction at that level. The drop in pH near the tissues shifts the oxyhemoglobin desaturation curve to the right, which promotes more oxygen dropping off of the hemoglobin. There are long-term changes or benefits that happen after exercise, but you'll hear more about those in class. So, related to the discussion of perfusing a tissue bed is the concept of anemia. Anemia is a decrease in the circulating red blood cell mass. You will get more on anemias in the pathology course, but I want to recap some lab values that help us determine that a patient is anemic. We can draw a venous sample and analyze the hemoglobin and hematocrit values. The hemoglobin is the molecule in the red blood cell that carries the oxygen and has a normal value of 13.5 to 17.5 grams per deciliter in men and 12.5 to 16 in women. The hematocrit, or the percentage that the red blood cells make up in the plasma, is usually 3 times the value of the hemoglobin, or between 38 and 50, with the lower values accepted for women. In anemia, even if the hemoglobin was 100% saturated, the amount of hemoglobin in the body may not be enough to carry oxygen to the tissues during exercise or even at times of rest. The system may be functioning at a total oxygen level deficit. And if we remember back to our previous lectures, that low oxygen is a trigger for vasodilation everywhere except for the lungs. When we look at the person who is running, we talked about the local dilating factors, but in systemic anemia, it looks like the whole body is exercising. The low total oxygen in the body can put us into a sympathetic response. We see the increased heart rate and the increased stroke volume to try and deliver enough oxygen to the tissues. In the case of the exercising patient, we had circulating catecholamines that diverted blood where we needed. Binding to alpha receptors mediated vasoconstriction, whereas binding to beta-2 receptors mediated vasodilation. However, this response is not there when we have a systemic low O2, like in the case of anemia. The anemic patient may have symptoms of fatigue even at rest and will certainly have a decreased exercise tolerance. If patients with anemia have underlying coronary disease, Any activity that increases the workload on the heart, causing it to need more oxygen, can lead to ischemic symptoms. You will work more with these types of examples in class. Be sure to understand the receptors at play and the underlying physiology to each change. Thank you guys for watching, and good luck with your studies.